Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the lumbar spine. It is the Biering-Sorensen test. So this test came from a paper in 1984 in which Dr. Biering-Sorensen looked at a large group of people from their 30s to 60s, men and women, in their little town of Glostrup. I hope I'm pronouncing that correctly. And they looked at a whole bunch of things, and they said, we want to see if we could predict individuals who are going to develop low back trouble. So they said, we're going to take all these measurements of things, and we're going to see who's going to end up dealing with some low back issues later. And they measured a ton of stuff from like height, weight. They looked at endurance in the back muscles, which is what we're going to talk about, things like leg length and all of that. So this is how you do the test. To perform the test, you have the person on a table or something like this. I have my legs strapped in down below. You want to have the iliac crest at the edge of the table. You can use a stool. I'm using a chair to kind of hold myself up right here to start with. Then what you're going to ask them to do is to hold this horizontal position as long as they can. Now, the goal is to hit 240 seconds or 4 minutes. If they're able to do that, they pass the test. But if they stop at any point or say like, I have pain or I have to let go, just record the time, and here are the norms based upon gender and age. And that is how you do the test. And getting into the research, they did find in the original article of looking at all of those people, those who had weaker back musculature with holding these positions were more likely to have that low back trouble. Now, this test has been found to be a reliable determinant of somebody who does have weakness in those back extensors. I mean, it makes sense because you're putting them under stress. There is an interesting thing that they did look at a study with younger individuals, more athletic, who have back pain, and they were saying, well, that you need to do more of a fatigue factor. So they were doing this test 3 times with them because they said, well, individuals who are younger, more athletic, they're going to be a little bit stronger, so you kind of have to put a little bit more of a fatigue factor in it. So that was kind of interesting. But also, there was a paper where they did find as well that individuals who do this maneuver, so hold this, have a better pain threshold in their back. So this could actually be utilized for helping individuals with back pain. And I will say, I have met individuals who say, yes, I like doing some isometric holds with individuals with chronic low back pain, or maybe it's just very irritable, and it's just a way that we can help kind of calm that down. But anyway, there you go. That is the Biering-Sorensen test. Let me know, do you ever use it? Should we look at it more? Is this something pretty interesting? Has it just gotten lost to time? Anyway, let us know down in the comments below. And as Mateo always says, take care of yourself, take care of your patients. We'll see you next time.